this video we will be doing a scan of the female pelvis. For this scan we will be using the low frequency curvilinear transducer. This scan is performed in both the transverse and the longitudinal planes. Initially, the transducer is placed in the transverse plane in the midline as close to the symphysis pubis as possible. The depth should initially be set to maximum and then adjusted to optimize the image according to patient body habitus. This scan is best performed when the patient has a full bladder. The full bladder is an excellent acoustic window to the deep pelvic structures. During this scan, we expect to see the following structures: the bladder, the uterus, vagina, the vesicouterine pouch, the rectouterine pouch, also known as the pouch of Douglas, and the rectum. The ovaries are more difficult to visualize, but can sometimes be viewed, especially when the follicles are well developed. Okay, so now we're ready to start scanning. The transducer is in the transverse plane. It has been placed in the midline in the lower abdomen as close to the symphysis pubis as possible. It is then tilted caudally, aiming deep into the pelvis until the bladder is visualized. Depending on the fullness of the bladder and the patient's anatomy, the uterus, cervix, and vagina will sit posterior to the bladder. These structures have a similar echogenicity to the abdominal wall muscle. Tilting the transducer more caudally demonstrates the vagina, which is flatter and has a straight line vaginal stripe. Posterior to the vagina is the rectum, containing the bright echoes of rectal air and the resulting acoustic shadow deep to that. The transducer is then tilted cranially to visualize the body and the fundus of the uterus. Return the transducer to the lower part of the body of the uterus and inspect for free fluid within both the vesicouterine pouch and the pouch of Douglas. This will appear as anechoic collections in these areas. Then rotate the transducer 90 degrees clockwise and place the transducer in the midline in the longitudinal plane. Once again, rock the transducer caudally in order to visualize the bladder with the uterus and vagina sitting posteriorly. Deep to the uterus and vagina is the rectum, and in this image we can see a brightly hyperechoic line consistent with air in the rectum. Tilt the transducer cranially in order to visualize the body and the fundus of the uterus. Take care to utilize the acoustic window provided by the bladder to visualize these structures. A brightly hyperechoic line is often visualized within the uterus, and this corresponds to the endometrial stripe. This line is at its thickest just before menstruation. Tilt the transducer to the patient's right and then to the patient's left, carefully examining for the presence of free fluid in either the vesicouterine pouch or the pouch of Douglas. Also, in patients with a positive pregnancy test, carefully examine the endometrial stripe for the presence of a gestational sac. This is one of several important factors when considering the presence of an intrauterine pregnancy. This completes the scan of the female pelvis.